Okay. So good morning to all dear students. So today
Good morning, sir.
we are going to
Good
start
morning, sir.
anterior triangle. Last time I told you about posterior triangle. So I told you about the side of neck. In the side of neck posterior triangle we have studied. And today we are going to see the anterior triangle. So the triangular area on the side of neck in front of sternocleidomastoid is known as anterior triangle of the neck. So the boundaries, if you see this diagram, anteriorly you have a midline. That midline is from here, symphysis menti to suprasternal node. So anterior boundary of anterior triangle is from a midline from symphysis menti to suprasternal node. And the posterior boundary is sternocleidomastoid. This muscle is sternocleidomastoid. The upper boundary is lower border of mandible. This is lower border of mandible. Then angle of mandible and a line from angle of mandible to the mastoid process. That is the superior boundary. And apex is directed out downward on the jugular node. So this is the anterior triangle. Now, when you see the roof of anterior triangle, all anterior triangle is covered by skin, superficial fascia, investing layer of deep cervical fascia. Then a thin sheet of muscle is also there. That muscle is known as platysma. That forms the roof of anterior triangle. Now, anterior triangle is crossed by the muscle. If you see the muscles of this is anterior belly of digastric, this is posterior belly of digastric, and this is omohyoid. The superior belly of omohyoid, the anterior belly of digastric, and posterior belly of digastric with stylohyoid, they passes through the anterior triangle, and in this way, anterior triangle is further subdivided into 3.5 triangles. Those are submental triangle, then you have muscular triangle, digastric triangle, and carotid triangle. Out of these, digastric and carotid triangle are major questions, and submental and muscular triangle are short note question. So we are for the submental first. So when you see the submental triangle, it lies below the chin. So here you see the submental triangle, it lies between the two anterior belly of digastric. The submental triangle lies between the two anterior belly of digastric. You see here, see this is submental triangle. So between the two anterior belly of the digastric, you have submental triangle. The base is formed by hyoid bone. Here you have hyoid bone, and apex lies at the chin. So in this triangle, floor is formed by the mylohyoid muscle. I'll show you the floor. The floor is formed by mylohyoid muscle. This one. This one. This is the mylohyoid, and then so this is anterior belly of digastric. So within this triangle, the structures are, you have submental vein and submental lymph nodes are there. Submental vein and submental lymph node are there. Submental lymph node are important because they drains from tip of the tongue, then they drains the hairs, this submental triangle, this region, and it is connected with the submandibular region also. So that's about the submental triangle. So you see once again, this is the submental triangle. Now another triangle, muscular, carotid, and digastric. These are the subdivision. All subdivisions are there. So here you see, as I told you, this is submental triangle. The boundaries I told you, floor I told you, then structure submental vein and the tributaries of anterior jugular vein. So this is submental triangle. Now muscular triangle. Muscular triangle is again very small short note question. So muscular triangle, as name indicate, it is made up by only muscle. No other contents are there, muscles are there. If you see the muscular triangle here, anteriorly it is bounded by a midline, dotted midline you see from symphysis menti to suprasternal node, and posteriorly you have this hyoid muscle, this superior belly of omohyoid, this muscle, superior belly of omohyoid. And within this you have sternohyoid, sternothyroid, thyrohyoid, and superior belly of omohyoid. 4 muscles lie in this muscular triangle. Once again, the muscular triangle is a small triangle bounded anteriorly by a midline and posteriorly by a superior belly of omohyoid, and 4 muscles, sternohyoid, sternothyroid, thyrohyoid, and superior belly of omohyoid are present in this triangle. Now these muscles are infrahyoid muscle, below the hyoid bone. And very easy to remember origin, insertion, now supply and action. First muscle sternohyoid. As the name indicates, it takes origin from sternum and insertion is on hyoid bone. Then sternothyroid. Origin is from sternum, insertion on thyroid cartilage. Thyroid. Origin is from thyroid cartilage, insertion on hyoid bone. And omohyoid. The omohyoid muscle has got two bellies, the inferior belly and superior belly. The superior belly is attached on hyoid bone and inferior belly is attached on suprascapular notch. And both they are attached over here behind sternocleidomastoid by a sling of fascia. So these are the muscles in muscular triangle. Now supply common. Ansa cervicalis nerve. C1, C2 and C3, ansa cervicalis nerve, it supplies the infrahyoid muscle, and I'll explain you the detail of this ansa cervicalis, that is a separate small topic. So these two are very small triangle, submental and then you have muscular triangle. Now these muscles, as I told you, all muscle 4 arrow you can make out. So 4 arrows are there. There are just wait. So the recording बंद कर दे, recording दिक्कत आती है ना, topic पूरा कर दे. Lecture पूरा कर. See, this is muscular triangle. These muscle lies over the thyroid gland. You can make out this is the thyroid gland. Now next we will see very important carotid triangle. As the carotid artery lies within this, that is very important artery. That's why we call it carotid triangle. If you see the boundaries of carotid triangle, see this one. The anterior superior boundary is formed by posterior belly of digastric and stylohyoid. You can make out this one. Anteriorly, it is bounded by inferior belly of omohyoid. This is inferior belly of omohyoid. And posteriorly, you have sternocleidomastoid. So it is a triangular area which is bounded anterior superiorly by posterior belly of digastric and stylohyoid, anterior inferiorly by superior belly of omohyoid, and posteriorly by sternocleidomastoid. So these are the boundaries of carotid triangle. The floor here, the floor is formed by the constrictor of pharynx, the superior middle constrictor and inferior constrictor and thyroid membrane that form the floor. And the roof is formed by investing layer of deep cervical fascia, skin, superficial fascia. Now, very important to know what are the content of this carotid triangle. See, as I told you, thyroid membrane, inferior constrictor. Contents are the common carotid artery. The common carotid artery lies in this. This common carotid artery divides into internal and external carotid artery, vagus nerve, internal jugular vein, ansa cervicalis. Then you have 11th cranial nerve, 12th cranial nerve. All these are important content of carotid triangle. Other than that, carotid sheath is there. Carotid sheath is also present in this triangle. So this triangle contains 10th, 11th, 12th cranial nerve, common carotid artery, internal carotid artery, carotid body, carotid sinus, ansa cervicalis. So a lot of important structures are there. Now, first we are going to see what are the content and what is significance. So the first content is the carotid sheath. I have told you in the short note previously, carotid sheath is a deep fascia of the neck which envelops the internal jugular vein, the common carotid artery, the beginning of internal carotid artery and vagus nerve. Three important structures. Carotid artery, internal jugular vein and vagus nerve lies within the carotid sheath. And ansa cervicalis nerve lies over the carotid sheath. So carotid sheath protects these important structures. So this is the one of the content, the carotid sheath. Other than that, you see here, this is the common carotid artery. This common carotid artery, okay, this common carotid artery, it divides here. Where it divides, it gives very important structure. This is carotid body and carotid sinus. So this is carotid sinus. And here you have carotid body. This is carotid body. What is carotid sinus? Where the common carotid artery ends and internal carotid artery begins. there we have a dilatation where the common carotid artery ends and internal carotid artery begins. The arrow you can make out. There we have a dilatation. The tunica media is thinner over here and tunica adventitia is thicker over here. And this is richly supplied by glossopharyngeal nerve and vagus nerve. These two important nerves supply to this. And this carotid sinus is known as baroreceptor. That respond to the pressure changes of the blood and it maintains the blood pressure. The blood pressure is maintained by this. So this is very important, carotid sinus. And the carotid body, it is a rounded oval shaped body where the internal and external carotid artery just begin. In between that area, you have a rounded oval shaped reddish colored body, that is the carotid body. And it is known as chemoreceptor because it responds to oxygen and carbon dioxide concentration and pH of the blood. This is again supplied by 9th and 10th cranial nerve, glossopharyngeal nerve and vagus nerve. So these two are the very important structure within the carotid triangle, carotid body and carotid sinus. Now carotid sinus, why it is important? Because the carotid sinus is present over here. Sometimes what happens, sudden rotation of the neck, okay, sudden rotation of the neck or head can cause syncope, faintness, person can fall down because of stimulation to this carotid sinus. Then what else is there? The carotid sinus here, some people suffer with supraventricular tachycardia. This is a condition which can be seen on ECG also, and patient has some palpitation. In case of supraventricular tachycardia, if in this region carotid sinus, if you do the carotid sinus massage, that can be relieved. Supraventricular tachycardia can be relieved by massage on the carotid sinus. Then other content you have